Hello once again and welcome. Let's get into the show. In Nigeria, authorities have begun tracing people who may have come in contact with the Italian man who has tested positive for the deadly coronavirus in the country. The Commissioner for Health in Lagos State, Akin Ababyomi, says the man entered the country on a Turkish Airlines flight that traveled via Istanbul. He's the first confirmed case in sub-Saharan Africa. The man traveled from Milan in Italy, then spent the night in a hotel near the airport in Nigeria, sparking fears that more people who came into contact with him could have contracted the infection. SABC Correspondent Phil Ihaza has this report from Abuja.
According to a statement by the Federal Minister of Health, Algeria Nigeria, the case was confirmed by the Virology Laboratory of the Lagos University Teaching Hospital. The minister said the Italian businessman who tested positive to the virus, also known as COVID-19, came into the country on February 25th, fell ill the next day and was confirmed to have contacted the virus the day after. Mr. Nigeria said that the patient is in stable condition with no serious symptoms and is being treated at an infectious diseases hospital in Lagos. He advised citizens to be calm and desist from spreading misinformation that causes fear or panic, but rather maintain good hygienic practices to prevent a possible spread. This is the first confirmed case in sub-Saharan Africa. The Nigeria Center for Disease Control, NCDC, says they have started working to identify all the contacts of the patients since entering the country. The NCDC says it has deployed its rapid response teams to support the Lagos State government and escalated a multi-sectoral coronavirus preparedness group to lead response activities. Nigeria's President Muhammadu Buhari is yet to make an official comment, but the government released over $1 million last week to the Health Ministry to prepare against and tackle the possible spread of the virus. Phil Ihaza, SABC News, Abuja.
Thank you there to Phil, but we're joined now via Skype by Dr. Mary Stevens. She is the Technical Officer at the World Health Organization Regional Office for Africa. Thank you so much for joining us this morning, Dr. Stevens, and we'll talk a bit about your work in terms of your focus on the African region, especially the sub-Saharan Africa. But of course, this is a global situation. Mr. Antonio Guterres saying that the window to avoid an epidemic is closing fast. What's the latest information that we have?
Good morning and thank you for having me. So in terms of global updates, as at yesterday, we know that globally we have over 80,000 confirmed cases with over 2,000 deaths. In Africa, as we already know, the Regional Office for Africa, which does not include Egypt, we have 2 confirmed imported cases right now. So the first case in Algeria, which was an imported case from Italy. The second confirmed case is also in Nigeria, which is also an imported case from Italy. So in addition to these confirmed cases, since the beginning of the outbreak in China, the Regional Office for Africa has been strengthening capacities in country to support preparedness for this COVID-19 outbreak. So part of the capacity we are strengthening is surveillance. And with this surveillance capacity, we've been monitoring alerts across the African region. And so far we have tested over 300 people across 31 countries in Africa, and of course 348 were discarded because they tested negative to the coronavirus. So at the beginning of the outbreak, we started with assessing the readiness capacities of the countries in Africa, and so we did we issued a checklist. And then we analyze the capacities across Africa. So with that capacity, we are targeting support to specific areas, especially areas where we find major weaknesses in countries.
You mentioned at the beginning of the conversation that it's 47 member countries except Egypt. So are we only talking about sub-Saharan Africa? And you've also put up a list of priority countries. Tell us which countries these are and why they have been flagged as priority countries.
Okay, so part of the assessment we did at the beginning of the outbreak in China is to look at our risks in Africa across the 47 countries. So we looked at primarily the volume of travelers to and from the affected areas and compared it with the international health regulations capacities of countries. So we categorize the countries in Africa using that information into three. So we have priority 1 countries, they are 13 in number. We have priority 2 countries, they are 14 in number. And then we have priority 3, which is the rest part of Africa.
So there are concerns about countries, for example, such as Zimbabwe, where there's already challenges with the cholera outbreaks there and the government is not coping. If they were to be hit, a country such as Zimbabwe, if they were to be hit by corona, would they be able to have sufficient response?
Okay, so just to take you a little bit back, to say that all countries in Africa are at risk of the coronavirus importation, but the risk is more. Some countries are at higher risk than others, so the risk differs from country to country. So now, for Zimbabwe, yes, apart from Zimbabwe, we have a number of countries that are also dealing with outbreaks. So in addition to the outbreaks they are dealing, we are enhancing specific capacities to detect, isolate, and manage COVID-19 case. So basically, sometimes when you're dealing with an outbreak, the capacities that you have already built for a certain outbreak, you can actually use it to respond to this COVID-19 capacity. So things like surveillance, for instance, you just need some little modification for people to be able to pick those cases and report them early and mount an effective response. So yes, we know there would be additional capacity needed to respond to COVID-19 on top of the cholera outbreak. But all we need to do is to make sure that we enhance that readiness capacities. Where we have yellows, we push them to green and be sure that we are able to detect early the first case, catch the first case, isolate, and mount an effective response. And of course, from the regional office, we are here to backstop. So any country that has an outbreak, we can quickly, within 24 to 48 hours, also deploy additional experts in country to support them with the response.
South Africa, for argument's sake, has come out to outline the kind of readiness in terms of any outbreaks here. Just give us a sense of the readiness of these 47 member countries that you're in charge of.
Okay, so basically, if you look at the readiness capacity, so we assess all the response pillars from coordination, surveillance also at the point of entry, the laboratory capacity, their case management capacity, infection prevention and control capacity, and also risk communication. So across Africa, we have areas already that are a little bit stronger than others. And this is also showing the same situation with regards to the international health regulations capacities. So countries have made progress in terms of coordination, for instance. So all our countries in Africa are able to activate their public health EOC or any coordination body they have within the shortest possible time to start a response. And then in terms of risk communication and also surveillance, we have, as you know, we have already a robust surveillance system in Africa that we have been implementing for the past 20 years, the integrated disease surveillance and response. So we are using that for surveillance for COVID-19 and also other diseases. And in addition to the integrated disease surveillance and response, we also have some sentinel surveillance in place in most of the countries in Africa for influenza, which you can also use for the COVID-19 outbreak. But the major areas where we saw challenges with regards to preparedness was the areas of infection prevention and control and also case management. So in a lot of countries, those areas still pose some challenges, but in a number of areas, the countries are making really, really good progress. So what we are doing is to provide targeted support to these countries, addressing those areas with greatest needs. So we have deployed experts to most of the priority 1 countries, including South Africa and a lot of the priority 2 countries, to help them address those gaps in those critical areas where we think they need urgent support.
You were speaking earlier about areas where you've investigated and discarded the cases because you were assured that there was no infection, but there's a lot of concern about transmission dynamics. Is there a follow-up in terms of these investigations that you start, even though you're satisfied that they're in the clear? Is there some sort of follow-up in terms of when they start to integrate into communities?
Okay, so in terms of investigation, so let me go back a little bit to the capacities. Yeah. So as you know, from in Africa, laboratory is one of the capacities where we had some little challenges at the beginning. So at the beginning, we had 2 reference laboratories, the one in South Africa and the laboratory in IP Dhaka that was conducting the tests for all samples in Africa, and then we gradually strengthen capacities. Now, as we speak, we have 31 laboratories that can test for coronavirus across Africa, and we are strengthening the capacities of the remaining countries so they can test. And then they also do a quality control. So for every sample you test, you have to send them to the reference laboratory for testing as well. So for any sample that has been tested in country and also in the reference laboratory and they turn out to be negative, yes, they are negative cases. But in terms of surveillance, we continue to do surveillance both at the health facility level and community and also at the point of entry, so that in case if there are any case, it can also be picked early, and then we can assess, do a laboratory test, and then determine whether or not it is a case.
So the latest development in South Africa is the president's decision during the week to allow South African citizens living in China to be repatriated back into the country. And some of those include citizens coming from Wuhan. Number one, how are you working with the South African Health Department to roll out this process? But also, 2, in terms of citizen concerns about people coming in from China, how do we handle this? What advice can you give?
Okay, so let me start addressing the issue in terms of concerns by citizens. So the best thing we need to do is to enhance our risk communication, to make sure that we provide the citizens the correct information, correct health information in terms of prevention and control, and also the dynamics of the outbreak. So we need to keep them informed to avoid fear, unnecessary fear, and of course, rumors with false information. So we need to keep the citizens informed on what we are doing, the information we know, what we don't know, and continue to update them on that situation. So in terms of collaboration with countries, South Africa is not the first country in the African region to repatriate its citizens. And so countries across the world, I believe you know that, are repatriating their citizens. But all we need to make sure is that the people we have, we bring them back home. We are able to monitor them for the 14 days. And then if there are no symptoms, then, of course, we can allow integration back into fully into the communities.
So in terms of the confirmed cases in Algeria and Nigeria, what's the latest there? How are these patients being treated?
Okay, so the cases are treated in the isolation facilities where the government has identified already for managing cases, which of course is part of one of the issues we address in the checklist when we're doing the assessment, is for government to make sure that they identify centers where we can isolate and also treat patients. So the government are doing that. Most of the countries in Africa have identified centers where they are treating the patients, and of course they are managing the patients in those centers.
So we're talking earlier about the United Nations cancelling an international women's event, in terms of, as you were saying earlier, that the countries where there's huge travel volumes are most at risk. What advice can you give African travelers, especially those people who are business people seeking to find better opportunities? What sort of advice can you give to them at this moment?
Yeah, so the advice is to make sure that we know the preventive measures. Of course, regular hand washing, the social distancing, and making sure that if there is a potential case or somebody is having some symptoms, you're sure to report early in the health facility, and also provide the right information to the health facility staff, because basically part of the screening we do at the point of entry, we recommend that they provide risk communication to all passengers coming in and going out from countries, so they know what are the preventive measures, what can they do to prevent themselves, and in a situation where somebody falls ill, where can I report and how can I access health services. So that information in most airports across Africa, if you go to the airport, you will see all those preventive information being provided in the airport. And also some are also providing pamphlets for you to travel with. So basic preventive information for everyone traveling in and out, and also everyone in the community, so that we can all protect ourselves.
Let's just remind our viewers about the characteristics of COVID-19 and how it is transmitted.
Okay, so for COVID-19, we know the transmission is through aerosols or droplets while somebody is coughing or sneezing. So if you come in contact with somebody that is already presenting with symptoms, that means that first of all, we have to apply that social distancing for anyone that is not infected, and also ensure that we practice this hand washing mechanism. And for those that are infected, if you know you have symptoms of coronavirus, to be sure that they use their face mask to reduce the spread to other people, and also a good use of coughing etiquette. So using the elbow to cover when you're coughing, so that you don't spread the virus to others.
Up to now, the virus has been referred to as a health sector emergency. But as I was saying to you at the beginning of our conversations, Mr. Couture is saying that the window to avoid an epidemic closing fast. How far are we from that?
Okay, so for me, I think basically what we need to do, especially for us in Africa, as you know, we just have 2 confirmed cases, to make sure that we continue to enhance our capacities for emergency preparedness and also response to this COVID-19 and any other outbreak. So what we are doing, we should just fast track and make sure that we are operationally ready to deal with this outbreak in case it occurs in our countries.
So in other countries, economic-wise, the politicians are starting to incorporate what's called the COVID-19 risk into budgets all over the world. But in terms of health budgets, how has this impacted your work and in terms of access to financial resources to make sure that the region is ready for any eventuality?
Yeah, so we have been advocating to governments, not just during current outbreak, but also in preparation for any potential outbreak, not just COVID-19, to make sure that, because we have all emergency plans, most countries in our regions have developed what we call our national action plan for health security, and we are encouraging government to put in domestic resources to make sure that we address most of the critical gaps we have in terms of our capacities to prevent, to dictate, and respond to emergencies. And of course, because the primary responsibility lies with our government, so we put domestic resources, and of course, when we have donors around, they can also support to cover those gaps that we have. But primarily, we need to take responsibility as government in Africa to invest in health security so that we can actually prevent, and where an outbreak occurs, we can dictate early and mount an effective response.
In your opinion, which countries in the region need assistance in terms of the efficacy of their infrastructure?
Okay, so for me, what I would say that in Africa as a whole, because of course you know our peculiarity, most countries need support in one area or the other, but the support of course varies from country to country. So like I said, some people will need more support in some areas like laboratory capacity, for instance, while others will require more support on case management. But of course, most of our countries, because the attainment of the international health regulations as required by all member states, in Africa we are still lagging a little bit behind. So every country will require support, but the support varies from country to country depending on their current capacity, because some are much more advanced than others.
Another conversation that has come out since the outbreak of COVID-19 or coronavirus is the safety of health workers. What is being done in this space?
Okay, so for safety of health workers, it's part of the case management capacities. First of all, we are encouraging countries to make sure that they sensitize their health workers. So the first thing is applying universal precaution. So whether there is COVID-19 or no COVID-19, all health workers should apply universal precaution when they deal with patients. So there are basic things that they need to do as health workers. And of course, for them, after the sensitization, knowing that they need to apply, we need to provide them the protective equipment that they need. And so far, we have been distributing protective equipment to countries and placing them in all those health facilities where government has identified as areas for management of COVID-19, so they can have access to those facilities. And we are making sure that every health facility, they have the information they require, so meaning that sensitization of all the health workers on COVID-19 and what they need to do also in addition to the basic precautions to prevent infection. And definitely also in terms of dictation, because we need the health workers not just to prevent themselves from infection, but where we are not able to pick the case from the point of entry. Let's say somebody like the case in Nigeria, the person came in asymptomatic and developed symptoms in country, we want the health workers to have high index of suspicion, take a very good history, and make sure that if you have a potential case, they are able to isolate this patient and transfer the patient to the appropriate facility.
Thank you so much for your time this morning.
Thank you.
Dr. Mary Stevens is a technical officer at the World Health Organization Regional Office for Africa.